I don't intentionally put out anything provocative, although a lot of what I say is provocative. But the intent is
Yes.
not to be provocative. The
Hmm.
intent is to expose something that I believe to be truthful. And if it provokes, well, that's just the consequence of putting something out that people are uncomfortable with or that are shocked by. But
Hmm.
I'm not a shock social media person. I know that you can get a lot
Yes.
of likes and follows doing that, but that's not really my goal. My goal
Yes.
is really to wake people up to important subjects that they may not be aware of.
Do you think that clinicians are doing a good job with waking people up with truth? What's your perspective on that?
I think it's gotten so bad now
Hmm.
that rule of thumb, I usually estimate about 80% of clinicians, when I say clinician, I mean physicians, psychiatrists, therapists,
Yes.
associated paraprofessionals, psychiatric, nursing staff. I'd say about 80% of them are incompetent.
Yes.
That's a pretty high number, but
Wow.
that's what I believe. And I look at that in my Rolodex. My Rolodex is about 80% smaller than it was 5 years ago. And that's
Hmm.
because those people that have been removed are largely people that I've lost confidence in their ability
Hmm.
to work honestly with their patients and to do the best for their patient, regardless of what it might cost them professionally or financially.
I agree. And I don't think that schools are doing a good job with that
I
either.
completely agree. It
I
starts in the training programs.
I mean, I'm just going to be honest. I remember what I learned in my therapy school, my master's program, but not a darn thing is used when you're actually treating a patient. Okay, there's wonderful theoretical approaches, but and I'm going to get so much hate on this. But I'm speaking from my personal experience. I don't use any of that. I think it's more about wisdom. It's what's worked 100 years before this. I think a lot of things are changed, and school system is rigged. It brainwashes you completely.
You can be an excellent surgeon, but a bad person with horrible
Yes.
ideas and utter confusion and disrespect for societal norms, but be an excellent surgeon because it's all technical. In
Hmm.
fact, I couldn't care less whether my surgeon is a nice guy. I want my
Right.
surgeon to be a
Competent.
competent surgeon.
Competent.
But with therapists, it's not so cut and dry because therapy, psychiatry, medicine that requires relational
Hmm.
work is necessarily driven by who you are as well
Yes.
as what you do technically, because you're not touching your patients. It's the only medical profession where you don't touch your patients, the only one. So something is going on that's not technical
Hmm.
in a physical sense, that
More
is,
power there, right?
it's also, there's a huge amount, I'd say much more power in the mental health field than there is
That's
in the
right.
surgical field. You have the ability to not manipulate someone's body, but manipulate how they think, how they grow, how they develop, their views,
Yes.
their beliefs. That's a much, much more
Yes.
impressive responsibility than simply cutting into somebody. So we should be even more careful in
Yes.
training programs about instilling foundational bedrock principles of morality, guidance, um, patient beneficence.
Yes.
And on the converse, if we don't do that, and we're not, programs that instill bad ideas are likely to produce much more harm than ideologically corrupted surgical training programs. As long as you get the good training on where to cut and where to sew, it doesn't really matter what ideas they teach you. But in therapy, if you get bad ideas, if you're told, for example, that it's in your patient's best interest to always affirm whatever the patient proposes, you
Yeah.
are going to be a bad therapist and you're going to hurt people. And that is exactly what therapists are doing right now.
I agree with you. Validating a lot of these mixed emotions, especially with everything happening in the woke culture right now. There's so many therapists validating this idea of, okay, you feel this way? All right. Oh, that's so unfortunate that your family's not accepting of this and that. And it's what the heck are we validating? What are we doing? We're hurting these children. How is it okay to validate a child that is so confused and traumatized and help? I
We're
don't even have
validating
words to
pathology.
say.
We have redefined pathology into virtue. I have been speaking about this now for 4 years, really loudly in the last couple of years. And one of my common tenets that I try to express and clarify for people who may not be aware of this is that we may not know this, not consciously, but we're living it all the time.